Female genital mutilation, a hidden issue in America. Female genital mutilation, FGM, is a human rights violation that affects millions of women and girls worldwide. While often perceived as a practice confined to certain regions of Africa, the Middle East and Asia, FGM also occurs in the United States. This article explores the prevalence, cultural underpinnings, legal frameworks, and efforts to combat FGM in America, highlighting the need for increased awareness and action. Introduction: Female genital mutilation refers to all procedures involving partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. The World Health Organization, WHO, estimates that over 200 million girls and women alive today have undergone FGM in 30 countries across Africa, the Middle East and Asia, where FGM is concentrated. However, due to migration and globalization, FGM has become a global issue, affecting communities in Europe, Australia, and North America, including the United States. Understanding female genital mutilation (FGM) is categorized into four main types. 1. Clitoridectomy, partial or total removal of the clitoris, and in rare cases, only the prepuce. 2. Excision, partial or total removal of the clitoris and the labia minora, with or without excision of the labia majora. 3. Infibulation, narrowing of the vaginal opening through the creation of a covering seal, formed by cutting and repositioning the labia. 4. Other, all other harmful procedures to the female genitalia for non-medical purposes, e.g. pricking, piercing, incising, scraping, and cauterizing. Cultural and social underpinnings. FGM is deeply rooted in cultural, religious, and social factors within families and communities. Reasons often cited include social norms. FGM is seen as a rite of passage and a prerequisite for marriage in some cultures. Control of sexuality. It's believed to reduce a woman's libido, thereby promoting chastity and fidelity. Aesthetic reasons. In some communities, altered genitalia are considered more attractive. Myths and misconceptions. Some believe FGM enhances fertility or is mandated by religion, although no religious texts prescribe it. Health consequences of FGM. FGM has no health benefits and poses severe risks. Immediate complications: severe pain, excessive bleeding, infections, urinary problems, and shock. Long-term consequences: chronic pain, cysts, infertility, complications in childbirth, and increased risk of newborn deaths. Psychological impact: post-traumatic stress disorder, PTSD, anxiety, depression, and sexual dysfunction. FGM in the United States. While FGM is illegal in the US, it persists clandestinely due to immigration. Communities from FGM practicing countries bring the tradition with them. Secrecy and silence. Fear of legal repercussions and community ostracism keeps the practice hidden. Vacation cutting. Families send girls abroad during school holidays to undergo FGM in their home countries. Prevalence. Estimating the exact number of FGM cases in the US is challenging due to underreporting. According to the Centers for Disease Control and Prevention, CDC, as of 2012, an estimated 513,000 women and girls in the US were at risk of or had undergone FGM. This number represents a significant increase from previous decades, correlating with immigration patterns. Legal framework, federal laws. In 1996, the US federal government criminalized FGM with penalties including imprisonment and fines. The law was expanded in 2013 to include vacation cutting. State laws. As of 2023, 39 states have specific laws criminalizing FGM, with variations in penalties and definitions. Challenges. Enforcement is difficult due to the private nature of the act and reluctance within communities to report. Notable cases in 2017, a high-profile case in Michigan involved doctors performing FGM on minor girls. This case was the first federal prosecution of FGM in the US. However, in 2018, a judge ruled that the federal law banning FGM was unconstitutional, stating that it was a matter for individual states. This ruling highlighted gaps in the legal system and spurred advocacy for stronger state-level legislation. Efforts to combat FGM in America. Legislative advocacy, pushing for comprehensive laws at both federal and state levels. Community engagement, working with community leaders and members to change perceptions and practices. Education and awareness, providing information to at-risk communities about the health risks and legal consequences. Healthcare provider training, equipping medical professionals to recognize and respond to FGM cases sensitively. Support services, offering psychological and medical support to survivors. Role of organizations, non-governmental organizations, NGOs, and community groups play a crucial role. The AHA Foundation, founded by Ayaan Hirsi Ali, it focuses on ending honor violence, including FGM, through education and advocacy. Sahio, an organization dedicated to ending FGM in the Dawoodi Bohra community, both in the US and globally. Equality Now, an international human rights organization that campaigns for legal reforms to protect women and girls. International context and US involvement. The US participates in global efforts to end FGM, United Nations initiatives, supporting resolutions that call for the elimination of FGM worldwide. Foreign aid, funding programs in countries where FGM is prevalent to promote education and alternative rites of passage. Research and data collection, collaborating with international bodies to improve data on FGM prevalence and effectiveness of interventions. Challenges and barriers. Cultural sensitivity, balancing respect for cultural practices with human rights considerations. Lack of awareness. Many in the US are unaware that FGM occurs domestically. Underreporting. Victims may fear repercussions or not recognize that what they experienced was illegal. Legal loopholes, inconsistencies in state laws and enforcement can hinder prosecution. The way forward, strengthening legislation, ensuring that federal and state laws are aligned and enforceable. Comprehensive education, implementing school-based programs to educate young people about FGM, empowering communities, engaging with community leaders to foster grassroots change. And survivor advocacy, amplifying the voices of survivors to raise awareness and drive policy change. International cooperation, collaborating with global partners to address FGM as a transnational issue. Conclusion. Female genital mutilation is not just a distant problem, it is a pressing issue within the United States that demands attention. Combating FGM requires a multifaceted approach that includes legal action, education, community involvement, and survivor support. By acknowledging its presence in America and working collaboratively, we can move towards eradicating this harmful practice and protecting the rights and well-being of women and girls.